Belgium is one of the worst hit places on earth right now, a 21% positivity rate. There's a town about an hour from here at 41%. Cases are turning into hospital admissions at a worrying pace, and if its spread continues like this, 1 in 1,000 Belgian citizens will be in the hospital with coronavirus in just 2 weeks. And so countries across Europe are clamping down with some pretty draconian measures. Here in Belgium, they're launching undercover health agents who'll go into businesses to ensure restrictions are enforced. They'll have the same powers as police to offer fines of up to $1,000. In France, President Macron has announced a nationwide lockdown. He said that this wave is likely to be deadlier than the first.
If you've been paying attention to what's going on over in Europe, we see multiple countries that, of course, that are, as the article says, bracing for lockdowns, as places like Belgium see record hospitalizations. Now, across all of Germany, there have been 10,706 deaths for the 558,000 cases as of November 2nd, right? This is updated as of November 2nd. There are 10,700 who have died from the virus. Now, if you actually look at the German population, I believe it's 88,000. Excuse me, 88 million. Let's just take a quick right, German population as of 2020, right? Excuse me, 84 million. So as of today, there are some 84 million. So out of the 10,000 or so that have died, right? So we'll just take the 10,700. So in terms of amount of people who have passed away as a result of the current virus, we'll just go ahead, we'll just round that off and we'll divide that by 84 million. So in terms of deaths to population, it is literally 0.0001 in terms of people who have lost their lives in relation to the population in Germany, right? It's 0.0001, which literally is 1/10,000th of a percent of German citizens in all of Germany have, in essence, lost their life to the current pandemic. And of course, Germany and many of these other European countries are going into lockdown. One in particular that we're going to take a look at is Belgium. There have been news outlets, of Belgium experiencing overflows in ICUs. Belgium hospitals reach ICU limit in 2 weeks as country tops incident charts. And this is, of course, is in relation to the virus. Now, as far as I can tell, it's a little hard finding accurate information about hospitalizations, but this is probably one of the best articles that I've come across that gives you the information about how many patients there are currently in Belgium. As the article says here, it says, as things stand, there are 4,827 people hospitalized in Belgium, with 757 that are in the ICU. Now, in terms of hospital beds in Belgium, there are 64,000. Where is it? Here we go. As of 2019, in terms of hospital beds just in Belgium, there are roughly 64,000. So we can just do the simple math of 4,800, right? We'll do 4,800 divided by 64,000, which gives you the percent of hospital beds that are dedicated towards someone who tested positive. And as you can see right there, it's 7.5%. Now, 7.5% is obviously larger than what we see here currently in the United States, which is about 5%. And of course, depending upon where in the United States, it could be even lower as 2.5 or 2.9%. For example, like in Florida, it's like 3% here in New York. So in terms of all hospitalizations currently in Belgium, about 7.5% of them are related to the virus. So even though, of course, there is this narrative that hospitals are overflowing any minute now, we're going to have to shut our doors, and if you get sick, you're not going to be able to find a bed. It's currently not the case, as you can see by the numbers from what they're stating. Now, with that said, it's important to understand in terms of all of Germany, as you can see, in terms of the case fatality rate, which is in relation to whether if you contract it, what's the likelihood that you're going to die. And as you can see, as of November 2nd, as you can see, the case fatality rate is 1.9%, which means that there is a 98.1% chance that you will survive, right? So if you get sick and you're required to go to the hospital, there is a 98.1% chance that you are going to survive. The other thing that's important to understand is, why is it that Belgium, of course, might be experiencing a little bit more of an influx of patients, and it might be related to the average age. If you remember several months ago, places like Italy, of course, were having a hard time, and that's because Italy has a very high average age. The average age of people in Italy, there are a lot of old people that live in Italy. And so, of course, as you can see, the average age in Italy is 46.5. And so Belgium, of course, is higher than, of course, here in America. If you actually look at the average age in America, it's 38.2. And so that might be why in areas like Belgium, where they're having a little bit, where they're having a little bit of a harder time with patients who are coming in who are, of course, sick. Again, if it's like what we've seen here in the United States, most of these patients who are coming in are probably towards the end of life expectancy, who would experience death typically to the flu or any other sort of infection, or more than likely be sent to the ICU, especially if that is, for example, a respiratory disease that can more than likely leave many of these individuals getting pneumonia, and then, of course, being placed into the ICU if they required, for example, to be placed on a ventilator. With that said, in terms of one thing that's important to consideration is, of course, despite the fact that they're seeing all these large hospitalizations and people, of course, are getting sick and coming to the hospital, Belgium has said, if you're a doctor or if you're any other sort of medical worker and you do test positive, still got to come to work. So if you were thinking that maybe I've got the virus, I'm going to get a day off, Belgium is like, it's just not going to happen. Even though they're really not having the spikes of cases that they're referring to, we are seeing that in certain countries, not exactly sure why many of these countries are choosing and opting to shut down and, of course, restrict the movement of their people. It's not related, of course, to the data. As I've said before, when you actually take a look at the data, as you can see, a lot of people necessarily, especially now and moving forward, we see a lot less people at risk of losing their life, even though there may be spikes in the number of people who are testing positive for a PCR swab. What we're not seeing is actually people at a higher risk of losing their life. Actually, we see the opposite. We see quite the opposite of individuals less likely to lose their life as a result, at the very least, of this particular virus. For whatever reason, that some of these countries, of course, are opting to, shut their inhabitants out, to shut down their cities and their economy, it's not related to the virus, at the very least, from the numbers that we can look up. In Germany, it's a little bit harder because they're not very forthwith. It's very easy. Like if you look up in France, or if you look up in England or in the UK, you can quickly find hospitalizations. And that's really the important thing, is to know hospitalizations, current hospitalizations. Are they seeing a rise in hospitalizations? What is the overall status of the health network in terms of what's the total number of hospital beds? And then look in relation to how many of those hospital beds are occupied by someone who has the virus. And that really gives you the state of affairs in terms of whether or not this virus is that deadly, whether or not people should be concerned, and whether or not countries, of course, are seeing a rise in cases, a rise in hospitalizations. That's really what matters. It does not matter how many people test positive for a PCR swab if they never require hospitalization, if they never actually have to go and see a doctor because they're not feeling well. If most of these patients, if the vast majority of these individuals just basically stay at home and then recoup within a week or two or in a few days, or literally have absolutely no symptoms whatsoever, then the question is, why are you shutting down your country?